If you have been recommended to have a lumpectomy for breast cancer treatment, or you may be recovering from this, what can you expect? Is it painful? Will I get a defect in the breast? And what will my breast look like? Stay tuned to find out. Hi, my name is Tasha Gandamihaja, here to help you navigate the world of health in general and breast cancer specifically. A lumpectomy, also known as a wide local excision, is an operation where a lump is removed. If you have been diagnosed with breast cancer and the lump is relatively small in size in relation to the size of your breast, then it is likely your doctor would have recommended this as part of your treatment. The aim of a lumpectomy is to remove the whole cancer with a good, healthy margin of normal breast tissue around it. If the cancerous area is not particularly obvious to feel, or if it was found on a mammogram, then we will place either a thin wire or a metal seed, within the cancer to help the surgeon find it and remove it at the same time as the surgery. So here are 5 things to expect following a lumpectomy. Lumpectomies are actually very well tolerated by most. The operation normally takes about 60 minutes or so, and my patients have these surgeries as day cases, which means that they can go home on the same day as their surgery. They don't need to stay overnight. You should be able to manage with simple pain relief for the first 48 hours or so. A few weeks and occasionally months after the surgery, patients do experience nerve-type pains around the surgery site. It is usually sharp and shooting, or even a burning sensation. And again, this is not uncommon as the area continues to heal. The scars aren't usually very long, and where it is placed depends very much on where the cancer is, as well as the surgeon itself. With time, scars on the breast heal very well, and they become a thin line after a year or so. If you have black or Asian skin, there is always a risk of developing a hypertrophic or a keloid scar. And this is where the scar heals, but rather than healing as a thin line, the scar becomes thicker and occasionally tender. Unfortunately, there is nothing that we can do as surgeons to prevent hypertrophic scars or keloids from happening. And if you do develop this, then have a conversation with your surgeon to see what can be done to help. So when the cancer is removed, there is a hole that is left behind within the breast. Now, to prevent the breast from having a defect, we would mobilize the surrounding breast tissue and move it around to fill the area where the cancer was. And so the breast will not feel like it did before the surgery. Instead, it will feel a little bit lumpy and firm. This does soften with time, but it can take some months. Despite our best efforts to minimize this, the shape of the breast can change a little. It may become a little bit flatter, and the contour of the breast can change. This is especially true after radiotherapy. And if you have had a lumpectomy for an invasive cancer or for moderate to high-grade DCIS, then it is likely radiotherapy would have been recommended. The effect of radiotherapy can vary from one person to the next. Some people are not particularly affected by radiotherapy, whilst others can be more so. Radiotherapy can cause the breast to feel firm, and the skin around it can feel slightly thicker. It can also cause the breast to shrink and become smaller. And so the effect of both surgery and radiotherapy can potentially cause the shape of the breast to change. As mentioned, the aim of the surgery is to remove the cancer in its entirety. However, even if to the naked eye it may look and feel that the cancer is all out, we won't know until the pathologist has had a look at this underneath the microscope. The specimen will be sent to the lab for analysis. And if under the microscope the pathologist is satisfied that the cancer has been removed in its entirety with a good margin of healthy tissue around it, then no further surgery is needed. However, should the margins be close, then more surgery may be recommended. And what will happen is that the surgeon will go back through the same scar and remove a little bit more of breast tissue. So for anyone who has a lumpectomy, further surgery is always a possibility, and this is roughly a 20% chance of this happening. After a lumpectomy and radiotherapy, these changes will continue to be present, and it's really important to be familiar with what the breast actually feel like post-surgery. Knowing what is normal is the only way to make sure that should anything new appear, then you will be the first to notice it. Any changes should always be checked by your healthcare professional. I will see you in the next one.